So what we find ourselves in is a fluid environment where we started with contact and droplet isolation, which traditionally you do have some areas of exposed skin, to newer recommendations where we don't want to have the exposed skin. We want to be more enclosed. So the evolution is for longer gloves, longer leggings, a hood, and a different air source from where we were just last week. The new recommendations also are a buddy system. So it's not just, for example, myself putting on personal protective gear. It's somebody helping me and double checking the quality of how that's put on. We have a dedicated training team. We have everybody cooperating in a spirit of we want to do this right and to the best of our capabilities. And if next week we have different recommendations, then we will retrain to those recommendations. First comes training, then comes practice, then comes drilling together as a team. The drill is really about having different people help different other people so they get more practice in donning and doffing their personal protective gear and having people work together to do that quality buddy system. This is a deadly virus, so we need to take this very seriously. So we need to slow down, recognize that we don't do this every day, so we need to help each other. So we're doing this as real time as we can during the drill, but we're not racing to get it done. The idea is that before the time's person expires who's taking care of the patient, the next person would start to don their equipment and take the 15 minutes that's necessary. Then they can go in and take over for the caregiver. That caregiver can come out and spend the 20 minutes that's necessary to doff the equipment. All done in a safe environment following containment principles.
Just get them in that room and keep that room the most contaminated.
The overall risk of having a true Ebola case in Salem is low. Number two is that we are doing everything in our power to take care of the patient if they do present to Salem Health. And the third is we're doing absolutely everything in our power to protect our staff and employees from exposure to a potentially deadly virus. If you're not trained, then we're not going to put you in harm's way. We are making sure that sufficient number of people are trained, that no one individual has to be put in harm's way that's not trained. And over time, we will spread out the training as we need to take care of patients in a logical fashion. We have about 50 people that are trained. And most of those are in the emergency room and ancillary services. So it's the trauma nurses, it's laboratory personnel, imaging or radiology personnel, and other support people, environmental services, etc., that would support the area. So that's our current focus of training. We're doing this in stages. Stage 2 would expand out to what we call our rapid response team, which covers the emergency room and the rest of the house as a backup. And we're making sure that there are multiple people on every shift that are trained so that if this does occur, we're not caught unawares.
Really hot.
To help speed that process up of making them slick.
There's stick going on. So here, if you'll just go ahead and take my hand and I'll guide you in here to where we're going to be at, okay? How are you feeling right now? Feeling pretty good? Yeah. All right, well, we're going to do some surgery to help you get better. Just get them in that room and keep that room the most contaminated.
way, you're going from back forward, put your head right there, and then pull that forward. And then it all goes into here, and let's turn the tapper off on the way in. The hood is just.
We'll take the gloves off as well.
Chair.
And as you're pulling it over the back of your head, look up, because it's got that elastic band.